I'm a physician, and I'm a gynecologist, but I have had a lot of experience with the mental health world through my family. My mom has a history of major depression and had a really traumatic childhood and a lot of unprocessed trauma and a really rough 20s, 30s, 40s, 50s, 60s with multiple episodes of suicidality. I was really lucky to be a doctor and to be exposed to the world of medicine and to have knowledge and access to what TMS is. So after trying many other treatments, my mom came to live with me to do something called extended protocol TMS. And after decades of being depressed on and off again, and the longest bout, which was 7 years of acute suicidal depression, we went through this treatment for 16 weeks, 1 hour a day at Stanford University, and my mom went from being unable to get out of bed in the morning, I would have to force her to eat, I would have to sometimes carry her down the stairs, to being like 100% functional and normal and normal as far as moms go, but just really her old self. And so it was technology that I was really lucky to be exposed to, knowing that not everybody knows about it. And it really saved her life, and it gave me my mom back, and it gave my kids a grandmother. So when I went through my own sort of traumatic journey in my career, I had some a bad patient outcome that was a really traumatic experience for everyone involved, and experienced symptoms of PTSD, followed by depression, followed by anxiety. I really didn't wait to get into a really bad state to try TMS myself. I knew that the technology was out there, I knew that it was really safe, and I also had the added advantage of all of the recent improvements that have existed in TMS, because with recent improvements in TMS, the treatment is now fairly effective over the course of 5 days rather than what my mom had to go through. I also have had the privilege of being able to find a clinic like Kind Health that's not really just about the sterile environment of medicine. My mom's treatment was incredibly effective, and I will always be incredibly grateful for the help that she received and for her well-being, but it was a very different environment. We were in a cold setting, it was just like a medicinal setting. And I think that my experience after going through TMS at Kind Health has been that added support of a compassionate team, a supportive environment, multimodal therapy. I was able to work here with a health coach who taught me techniques to reduce the discomfort and to not just have the medical side, but also have tools to take out into the real world when I finish treatment. It's just been something that is a place that's very different than most of the places that I've experienced in medicine. I think medicine these days can feel quite overwhelming as a patient to consume. And you can feel like a cog in the wheel, you can feel like you are a number, and I think especially being in a mental health crisis and feeling really extra vulnerable, that additional compassion is something that makes an enormous difference. It is, I would say, my experience, the first day is the hardest. It's a scary thing to get brain stimulation, even if you are a physician and you understand all of the risks and the benefits and you understand that it's very safe intellectually. It still requires a tremendous amount of vulnerability to start treatment and to have someone stimulate the cells in your brain. And it's not always a comfortable experience. I wouldn't describe it as painful, but it's not uncomfortable. And so having a team that holds your hand and cares about you and helps you get through that initial bit of fear and discomfort and uncertainty is really what makes all the difference, I think, in not just starting treatment, but completing treatment.